We are in the middle of an epidemic. Not just any epidemic, but what many experts call the worst public health crisis in American history. At the center of it all, a single, powerful family, the Sacklers. Their company, Purdue Pharma, manufactured and marketed the now infamous drug OxyContin, fueling a wave of addiction and death that ravaged communities across the United States. How did it happen? How did a respected medical dynasty become one of the most notorious families in modern American history? Welcome to the dark story of how billionaires in white coats became drug dealers and how their pursuit of profit devastated millions. The story begins in 1952 when three ambitious psychiatrist brothers, Arthur, Mortimer, and Raymond Sackler, bought a small pharmaceutical company called Purdue Frederick. Arthur, the oldest, was not only a doctor, but a marketing genius. He revolutionized pharmaceutical advertising, convincing journals to run flashy drug ads and helping drugs like Valium become household names. He even coined terms like psychic tension to broaden the customer base. But Purdue's most profitable invention was still decades away. In the 1980s, the company released MS-Contin, a powerful morphine pill used for end-of-life cancer care. Since addiction wasn't a concern in terminal patients, it was widely accepted. Then Purdue got bold. They reimagined MS-Contin as a general-use painkiller. Soon after, they created its successor, OxyContin, a slow-release formulation of the even stronger opioid, oxycodone. Many doctors believed, falsely, that this version was safer and less addictive. Purdue backed this up with misleading studies and aggressive marketing. In truth, OxyContin was 50% stronger than morphine, and the FDA approved it. With FDA approval in hand, Purdue launched a marketing blitz. They sent out armies of sales reps, showered doctors with incentives, and handed out coupons to patients. They didn't just market a drug, they sold a dream. A pain-free life. By 2001, sales passed $1 billion. Purdue was booming. But behind the scenes, chaos was unfolding. Addiction rates surged. Patients who began with OxyContin moved on to heroin or fentanyl. Whole communities, especially poor, working-class towns, were swallowed up in overdose deaths. And Purdue knew. Internal memos revealed that executives were aware of the abuse early on. Yet instead of pulling back, they doubled down. If a patient said the drug wore off too fast, doctors were told to increase the dosage, not the frequency. This amplified the withdrawal symptoms and pushed patients further into addiction. Though Purdue was the face, the Sackler family was the brain and bank behind it all. Richard Sackler, Arthur's nephew, took over as president in 1999 and was deeply involved in Purdue's operations. He sent secret-coded memos to staff and managed OxyContin's rollout with surgical precision. Even after the dangers were clear, he pushed harder. When asked about the growing number of deaths, Richard reportedly said, "That's not too bad. It could have been worse." Publicly, the Sacklers remained out of sight. Privately, they funneled billions into museums, universities, and galleries, branding their name across the cultural elite, from the Louvre in Paris to the Met in New York. They wanted their name associated with art, not addiction. By the mid-2000s, the lawsuits began. In 2007, Purdue pled guilty to felony charges of misbranding OxyContin. The company paid $600 million, one of the largest pharmaceutical settlements ever. But no Sackler was charged. In fact, the Sackler name wasn't even in the guilty plea. Instead, Purdue settled quietly, again and again, always avoiding public court battles, always protecting the family. Behind the scenes, the family had already started moving money offshore, preparing for legal storms they saw coming. It's easy to talk numbers, over 200,000 opioid-related deaths since 1997. 11 million people abusing prescriptions. 214 million opioid prescriptions handed out in a single year. But behind each stat is a person, a student, a parent, a patient who just wanted pain relief. Like Travis Reeder, a bioethics professor who nearly died from opioid withdrawal after a motorcycle crash. His doctors gave him pills, then offered no guidance on how to stop. "I felt like I had the flu," he said. "Then I couldn't stop crying. I couldn't sleep. I was in hell." His story is tragically common. Patients were left alone, dependent, and desperate. Some turning to heroin, others dying in their sleep. In 2019, the dam finally began to break. Public outrage spilled into museums. Protesters dumped prescription papers from balconies at the Guggenheim. They chanted, "Shame on Sackler." Institutions once proud to display the Sackler name began to distance themselves. The Louvre, the Tate, the National Portrait Gallery all cut ties. Under pressure, Purdue filed for bankruptcy. The Sacklers agreed to pay billions in settlements, but admitted no wrongdoing. Even more chilling? While Purdue was being sued, a Sackler-owned company patented a drug to treat opioid addiction. Yes, you heard that right. The same family who helped cause the epidemic may now profit from treating it. The Sacklers aren't the only ones to blame for the opioid crisis. But they were among the first and the worst. They disguised marketing as medicine. They silenced critics with money. They built an empire on pain. And now, that empire is finally crumbling. The opioid crisis is far from over, but public awareness is growing. Laws are tightening. Treatments like Narcan and methadone are saving lives. Some states are exploring medical cannabis as an alternative. Doctors, scientists, and activists are fighting back. And thanks to brave whistleblowers and relentless journalists, the truth about the Sacklers is out. Arthur Sackler once told his children, "Leave the world a better place than it was when you came in." He did the opposite. Now, we know the cost of that lie, and we will never forget it. If you've made it this far, thank you for taking the time to learn about this important and tragic story. Let's keep asking questions, holding people accountable, and demanding better, for ourselves and for future generations. Take care, and I'll see you in the next video.